Good morning, everyone. Before we begin the Board of Health public hearing, I have an introductory statement to make. This public hearing is to discuss the proposed tobacco control regulations for the town of Shrewsbury. Copies of the proposal have been made available at the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. The Town of Shrewsbury Board of Health is a 3-member board. The purpose of the board is to promote and protect the public health for the citizens of the Town of Shrewsbury. They derive their authority from the Massachusetts legislature. The members are Stephen Vigent, Jenny Fishman, and Dr. George Abraham. The City of Worcester Division of Public Health is the health agent for the Town of Shrewsbury, a member of the Central Mass Regional Public Health Alliance. The duties of a health agent are to carry out the wishes of the board, assist in the enforcement of their regulations, and deal with the day-to-day operations of the Board of Health. It is uncommon for the Board of Health to hold public hearings on proposals before them, even though all proposals are dealt with at meetings to which the public is always invited. However, because of the broad interest in tobacco control, every effort has been made to provide a public forum for the exchange of ideas and views. As the purpose of the public hearing is to collect information and opinions, the board will not ask for a vote from the audience, nor will the board itself vote on the proposal at this public hearing. The board will announce the meeting date to which they will discuss and vote on the proposal. This meeting will be public. However, the board will not provide time for further public testimony unless a board member has a specific question to which an audience member can offer some clarification. After the public hearing, the board will accept written testimony for a period of 8 days until October 31st, 2020. Letters can be mailed to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. If the proposal is passed, the approved regulation will be posted at the Board of Health office and will be publicized in summary form in the Worcester Telegram and Gazette within 1 week of passage. Welcome to the Shrewsbury Board of Health public hearing to discuss a proposal to change the tobacco regulations. We appreciate your taking the time to be here. A copy of the regulations is available at the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. In the interest of time, we ask that you adhere to the following ground rules. Any person wishing to make comments should sign in. Before addressing the Board of Health, you must have read the proposal. When addressing the Board of Health, you must first identify yourself by name, address, and any professional affiliation you may have that impacts your comments. Identify the section of the proposal that you wish to comment on. Please limit your comments to 2 minutes so that other members of the audience will have a chance to speak. Please be considerate of those persons speaking, whether you agree or disagree with them, and refrain from commenting out of turn. A written comment period for those who are unable to attend or do not wish to testify at the public hearing will be allowed. Written testimony will be accepted by the Board of Health until October 31st, 2020. Please send comments to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. Any person showing verbal disrespect to those speaking will be asked to leave the public hearing. And thank you for your cooperation. Okay, pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 20A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of the public hearing, dial 1-617-675-4444 and enter the following PIN number, 826-800-957-8932 #. Please mute your device until the chairman of the board addresses the agenda item or opens the meeting to public comment. This public hearing is to consider amendments of the current tobacco regulations, regulation of the Shrewsbury Board of Health, restricting the sale of tobacco products, 2020, changes that reflect the new state law, and no new adults only retail tobacco store shall be located within 25 feet of a retailer with a tobacco product sales permit. Complete text of the proposed regulations are available in the office of the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545 by appointment. Please contact the Board of Health at 508-841-8384 if you need to schedule an appointment. Any person wishing to be heard should appear at the time and place designated above or should send a letter to the Board of Health in time to be read during the hearing. Please note individuals requiring special accommodation should contact the Health Department at 508-841-8384 at least 5 days prior to the hearing date in order to facilitate your request. Thank you. So I'll now call the public hearing in order. And the agenda includes the Shrewsbury Board of Health conducting a public hearing to discuss the following revisions to the current tobacco regulations. The first one is incorporating all new state law changes. And the second is no new adult-only retail tobacco store shall be located within 25 feet of a retailer with a tobacco product sales permit. So at this time, I would like to open the public hearing to any public comment. If anyone wishes to make a comment, please do so by stating your name, address, and any professional affiliation.
Good morning, board. My name is DJ Wilson. I'm the Tobacco Control Director at Mass Municipal Association. Thank you for taking this effort to update your regulation to have it conform with the new state law that was put in place in 2019. This is, I believe, the third time or second or third time we've been together. And I will note that I did send to Kerry the highlighted version and the unhighlighted version, and neither one of them, I believe, has that standard 25-foot language away from schools. So I'll make sure that that gets in. So if you decide you won't be voting on this today, so I will make sure that gets in. I get it to Kerry. But thank you again.
Okay, thank you, DJ. Yeah, I do see that in the definition section, it's in the adult retail tobacco store has the 25 feet of a retailer with a tobacco sales product permit, but we'll make sure of that. Okay, is there anybody on the call who would like to make a comment on the proposed amendments to the tobacco regulations? Kerry, do you know of anybody else that may be on the call?
There isn't anyone.
Okay, so hearing no additional comment or input, does the board have any further comment or questions? Dr. Abraham?
No questions.
Jenny Fishman?
No questions.
Okay, since there are no further comments and the board will not be voting on this until a future meeting, I would like to ask for a motion to adjourn the public hearing.
So moved.
I second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent, aye. Okay, so the public hearing is now adjourned. And we will move to the regular Board of Health meeting. As a preliminary matter, this is Stephen Vigent, Chairman of the Shrewsbury Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jenny Fishman?
Here.
Dr. George Abraham?
Here.
Staff, when I call your name, please respond in the affirmative. Kerry Stockwell.
Affirmative.
Anticipated speakers on the agenda, please respond in the affirmative. Phil Legere.
Affirmative.
Micah Blondeau.
Affirmative.
DJ Wilson. DJ may have left after the public hearing. Jennifer Nakajoba. Okay, so let's move on. Good morning. This open meeting of the Shrewsbury Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Shrewsbury Board of Health is convening by telephone by dialing 1-617-675-4444 and entering the following PIN number, 826-800-957-8932, #, as posted on the town's website, identifying how the public may join. We are now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. Stephen Vigent, the chair, will introduce each board member or staff member who has the lead role for this particular item or guest speaker associated with this item on the agenda. After they conclude their remarks, the chair will go down the line of members first, and then to staff members, inviting each by name to provide any comments or questions. I will then call upon the members to offer a motion and then for a second. Please hold until your name is called. Further, please remember to mute and unmute your phone by pressing *6 or mute your computer when you are not speaking so as not to trigger your camera feed or background noise. After members have spoken, the chair will afford public comments as follows. The chair will first ask members of the public who wish to speak identify their names and addresses only. Once the chair has a list of all public commentators, I will call on each by name and afford 3 minutes for any comments. For any response, please wait for the chair until the chair yields the floor to you and state your name before speaking. If members wish to engage in colloquy with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken at this meeting will be conducted by a roll call vote. This meeting of the Board of Health is being held on Friday, October 23rd, 2020 at 8 a.m., and it's following the conclusion of the public hearing. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 20A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of this public meeting, dial 1-617-675-4444 and enter the following PIN number, 826-800-957-8932 #. Please mute your device until the chair of the board addresses this agenda item or opens the meeting to public comment. I would like to call the meeting to order. And the first item on the agenda is to review and approve the minutes from the September 18th, 2020 Board of Health meeting. Has the board had a chance to review the meeting minutes?
Motion to approve.
I second.
Okay, all in favor signify by saying aye. Dr. George Abraham,
Aye.
Jenny Fishman,
Aye.
Steve Vigent, aye. So the meeting minutes from September 18th, 2020 are approved. The next item on the agenda is review and discuss coronavirus COVID-19 update. Do you have anything, Phil, that you would like to address in this regard?
Just going over the Stop the Spread sites have been extended till January 15th. And at this point, we're watching, third surge and to red. I think what we're having issues or people, going back to school, going places. So it's inevitable that case counts are increasing. So our nurses have been following that closely. So that's a concern across many areas of the state right now. There was a tenant assistance package that came out recently to help with trying to keep folks in their tenancy. And we got a call at 9 o'clock for an update. So that's what I have at the moment. If you've got questions.
Phil, is it true that it seems like the new additional cases seem to be kind of skewed towards younger people?
Apparently, yes. So they're talking about, family spread, community spread, etc.
Okay, are there any other comments from the board? Dr. Abraham?
No comments or no questions. Thank you.
Okay, Jenny Fishman?
Nope, no comments or questions.
Okay, so let's move on to the next agenda item is to review and act on revising local body art regulations. And I believe this came about because there's been interest in establishing a body art establishment in Shrewsbury, and our current regulations are somewhat out of date. So Kerry has graciously put together a draft of new or revised body art regulations based on the Luster's regulations, Kerry?
Yes, that's correct. Thank you.
Okay. Unless the board had any chance to take a look at these proposed revised regulations.
Yes.
Okay, Dr. Abraham?
Yes, same here.
Okay. So I guess, is it the feeling of the board that we should go ahead and pursue revising these regulations, and we'll have to conduct a public hearing sometime down the road on that?
No, I think it makes sense to update them at this point.
Okay, yeah, I believe that given that we have interest in establishing, or they may have already been established in Shrewsbury, I think it's something we should do to be up to date. So when we get to the reviewing the meeting schedule, we should probably discuss when we should consider conducting a public hearing, or if the board needs any more time to review the regulations.
No, I think we can, even the next month or the month after could be reasonable. Needless to state, I think if other priorities come in there, which become more prescient, then we can push this out a little more. This is relatively non-emergent compared to the other issues that we might be dealing with.
That's true. I agree, Dr. Abraham. Okay. at this point, let's move on to review and act on the report from the Central Massachusetts Regional Public Health Alliance.
Well, that's me. Okay. I'm just going through my notes here. We're just trying to stay ahead of the flow, basically stay ahead of the state guidance in complaints or follow-ups come in almost daily. Keeping up with the food inspections, Micah will give you that report. I already mentioned Stop the Spread. Been extended, so right now it's trying to stay ahead of what's coming, virus cases, and follow up with businesses when they have cases in the business. I can on a triple E, I think we made it through the season, knock on wood, which that relatively unscathed, which I'll take that for sure. And so that's what I have. If you have anything specific from that report, I'm on Google Docs, but it's not loading every single thing right now. It's taking a long time because I'm remotely accessing it from my laptop.
Okay, are there any further questions or comments from the board in regard to the report from the Alliance? Dr. Abraham?
No, none further. I've been in communication with Dr. Hirsch and others. We are a little think tank which meets almost every other week to address the issues in the city. So I'm aware of most of what's going on. Thank you.
Okay, Jenny Fishman?
Nope, all set.
I was just curious. I know the farmers market is over. Did that seem to go reasonably well this year?
Yeah, I think that they did. This is Carrie. I think that they did a really good job considering the pandemic and keeping all of their patrons and their staff members safe. So I think they did a really good job.
Okay, very good. Unless there are any further comments or questions, I'll move on to the next agenda item, which is reviewing our meeting schedule. As part of the meeting schedule, I would ask the board if they would be willing or like to vote on the revised tobacco regulations after we've gone through the public comment period, which ends October 31st, if you would like to vote on that at the next meeting.
Absolutely.
Yes.
Okay. And then in regard to the body art regulations, I tend to agree with Dr. Abraham that perhaps we shouldn't schedule a public hearing immediately. By that I mean that the very next meeting of the Board of Health, perhaps the December meeting, but we could discuss that at the next meeting if the board is agreeable to that.
Completely agree, Mr. Joy.
Yep, that sounds fine.
Yeah, because we have some agenda items at the next meeting that we'll need to focus on. So that sounds good to me also. So in terms of and then when we do vote on just so the board knows, when we vote on the revised tobacco regulations, we'll have to set a date, an effective date for the regulations, and we can discuss that at the next meeting.
Sure.
Okay, so given that next month is November and we have Thanksgiving on the 26th, I would assume we want to avoid the day after Thanksgiving.
If possible, so November 20th works fine on my calendar if Jenny's works as well.
November 20th is fine with me. Jenny, does that work for you?
It does.
Okay. Oh, I'm sorry. I didn't quite hear that. That's good for you?
Yes, it is.
Okay. So Terry, let's plan on the next meeting on Friday, November 20th at 8 a.m.
Absolutely. I'll send out a meeting invite accordingly.
Okay. So given that, do I have a motion to adjourn the meeting?
So moved.
A second.
Okay. All in favor signify by saying aye. Dr. Abraham.
Aye.
Jenny Fishman.
Aye.
Stephen Vigent. Aye. So the meeting is now adjourned, and thank you all very much for joining us today.